And good evening from India. This is Dr. Gaurang, and wanting to share an interesting remedy before I call it a day today. And I hope you're doing well in these difficult times, and we are trying our best to help patients, all types of patients that we are seeing in the clinics here in Mumbai and in India, and also we are trying to see if patients which are in the who are even suspect COVID and COVID cases, because not all patients are getting investigated. So symptomatic patients are calling us from different places, not just in Mumbai, in Belgaum, in Gujarat, in Surat, in Ahmedabad, in Pune, in the other parts, in Punjab, in um, other parts of India, Hyderabad, even in other countries. They are emailing us, and we are trying to help as much as possible how homeopathy can support um, patient as much as possible. And there are very frontline remedies here, common remedies: arsenic, bryonia, rustox, antimars. I spoke about that. China, especially China Sulf in Indian subcontinent, very important remedy. And also some nosodes, medorinum, etc. And I believe most homeopaths who you are watching my videos, you know about these remedy. I felt of making videos which will be very useful for you to use in your practice, so that you can help cases, not just COVID but even post COVID. Patients are developing a lot of breathlessness, breathing issues, um, um, cough, eye issues, joint issues. How we can use our homeopathic literature to it, I wanted to share with you, because a lot of emails I've been getting, and I've been trying to support a lot of my students who are treating these cases, and guiding them what to prescribe. So I wanted to talk to you about a remedy today. Grindelia robusta belongs to compositor family or sunflower family. Interestingly, Grindelia, the remedy is the name is after Dr. Grindel, a botanist. And there are two actually, Grindelia robusta and squarosa. There's not much difference, but mainly we are using Grindelia robusta. And when do we use this remedy is also very interesting. So I will just give you a picture of this remedy for you to know. If you see a case of let's see this, yeah, if you see a case of lot of breathlessness, cough, person whose expectorations are very high, lot of wheezing, thick thick tenacious expectoration, thick tenacious expectoration, especially aggravated lying down, ameliorated by sitting up, aggravated by sleeping, better by expectoration. You are thinking about Kali Bai, or you are thinking about arsenic, but you are not sure what to give. This is when you should think about the remedy that I'm going to talk to you about today. That is the remedy Grindelia. And what is the symptom of Grindelia that I want to tell you? So yes, Grindelia has a very important action. In fact, causes paralysis, not just of the cardiopulmonary and pneumogastric area, but also of the lower limbs. That's why it's important for sometimes a kind of Conam or curare like paralysis from down to up. So smothering after falling asleep, asthma, chronic bronchitis, bronchoria with tough mucus, difficult detachment, also comorbidity of heart complaints like raised blood pressure, diabetes. So when you see uh, concomitant of diabetes and hypertension with acidity, with this breathlessness, with suffocation, with expectoration, ameliorate. Think about this remedy, Grindelia, and very important remedy here. Foamy mucus at times. Also, pulmonary hypertension can be caused. Weak heart pathology, aggravated lying down, and kind Stokes breathing. Another remedy is aconitum ferox in boric materia medica. You should know about this, and it's very important remedy for spleen enlargement also. Yeah, you should know this. And there's a very interesting, nowadays we are treating COVID cases. Many COVID cases are getting eye symptoms, post COVID. So it's a very important remedy for eye pain in the eyeball, running back to the brain, worse by moving the eyes. So very important remedy. Very important remedy I'm using a lot along with Grindelia to increase the oxygen saturation or breathlessness very nicely, aspidosperma. All of you keep aspidosperma with you. We will require it at some point. A very interesting remedy for our patients. Some more very interesting thing about this remedy. Asthma, especially with cardiac involvement and breathing on going to sleep, and they get up with breathlessness, cough with breathlessness, always expectoration, which is very thick, difficult to remove, especially left lung pneumonia. You will see that. Um, Heart is the accompanying symptom. Sequelae of pneumonia. So post pneumonia cough. Think about this. Another remedy, pneumococcinum. Okay, I told you about the eye symptom. Also iris, iritis. Yes, yes. This is also very important. Another very important thing that I want to tell you is that Grindelia has a lot of fear, and fear, not just anxiety, but fear of dark. They want a lot of light. So one very important rubric, you should note it down: desire for light, sunshine, society, and mankind. So they need a lot of people around them, little bit like stramonium in state of mind. Want sunshine, want society. Think about this. And fear of suffocation due to mucus in the trachea. They startle very easily. They're very stupefied better by walking also. You should know this. And more or less, this is a very important keynote: expectoration ameliorate. Asthma, this is the Pierce cough symptoms. This very important book I use, Pierce cough and Pierce plain talks on materia medica. I hope you read this book. Very, very brilliant book in today's times. Asthma with profuse secretion, asthma reliefs, and when there is edema of the lungs. Okay, and only sitting up makes them feel better. So Grindelia. Grindelia use it in 6 and 30 potency. Learn all these remedies. We are going to be needing these remedies to help a lot of our patients. Note it down and try to help patients in and around you. We as doctors, we need to help. Learn homeopathy. We will be requiring to help a lot of patients. If not help, at least support a lot of them. If you're seeing COVID cases, make sure you're wearing masks, make sure you're keeping the distances. And if you're seeing COVID cases and if you need my help, you can write to me and I will try to help you as much as I can. Thank you and good night from Mumbai.